Hi everyone, my name's Hussain and I'm a USMLE Step 1 and Step 2 tutor with MedSchoolCoach. Today we'll be doing a question of the week and it will be a USMLE Step 1 question. So here's our question and we'll start by just reading through it and then we'll take a pause, give you guys a second to think about it, and we'll kind of work through the answer choices. So to get started here, we have a 5-year-old boy who recently immigrated from Sudan and is brought to the clinic by his parents due to pain and swelling of his hands. The parents state that the boy has had several similar episodes previously. He appears to be in pain and looks distressed. His temperature is 99.5. Physical exam reveals swelling on the dorsum of his hands and fingers, and the dorsum of his hands and fingers are also warm, tender, and demonstrate pallor. Which of the following complications is associated with this boy's current condition? So I'll go ahead and give you guys a moment to pause the video here and kind of work through the answer. All right, welcome back. I hope you had a chance to think about it. And now let's talk about each of these answer choices and kind of get into this question here. So the first answer choice says conjunctival injection. So this answer choice is going after the diagnosis of Kawasaki disease. So Kawasaki disease commonly has swelling in the door or hand and foot changes, so swelling in the back of the hands or in the palms of the hands. Now, although that clue is there, some of these things kind of throw off the diagnosis, and some of those clues, for instance, being that he's had several similar episodes of this previously, and also that his hands demonstrate pallor, and also the fact that we're missing some of the other characteristic features that we expect. So for Kawasaki disease, the common mnemonic that we use is crash and burn, and crash being conjunctival injection for C, and then rash, adenopathy, strawberry tongue, and hand and foot changes. So that's crash, and burn for very high fever. And we also see that this patient is afebrile. So given that he's only really demonstrating the edema of his hands and not all the other characteristic features, as well as not having a fever, Kawasaki disease is very unlikely in this case. Um, Answer choice B says daily spiking fevers. So that answer choice is going after a diagnosis of juvenile idiopathic arthritis. Um, Now, although he does have some pain in his hands and fingers, it doesn't really seem to be an arthritic picture in this case, and not a juvenile idiopathic arthritis, because for that diagnosis, we typically expect a salmon-colored macular rash in combination with arthritis and fever and potential anemia. So here we don't see that fever, we don't see the salmon-colored rash that we expect, and nor the anemia. Furthermore, the juvenile idiopathic arthritis diagnosis would typically involve larger joints such as the knees, wrists, or ankle. So, with all those things in mind, it's unlikely to be daily spiking fever. Now, C, purulent drainage from the joint, that would be going after a septic arthritis. So again, here, while we have some of those symptoms, such as the warm and tender joint, it does lack some of the hallmark symptoms that we're really looking for to diagnose something as septic arthritis. So, for instance, fever would typically be a very big clue in that direction that there's an infectious etiology for his joint pain. However, in this case, we don't see that. And furthermore, again, with the similar episodes occurring previously and some of this recurrent like picture that we're seeing, it's highly unlikely to be purulent drainage. And again, that doesn't fit the picture of the pallor that's demonstrated in this vignette. So D is saying malar rash. So a malar rash is could potentially be going after a few different diagnoses here, potentially something along the lines of a lupus-like picture, as that's a very common rash that's seen in SLE. However, again, kind of similar to the other previous answers, we don't see the hallmark symptoms for lupus. There's many symptoms that we expect beyond just the arthritis. So in this boy with recurrent joint pain and or recurrent swelling of the hands and feet, as well as pallor, lupus isn't very high in the differential, given the lack of characteristic lupus symptoms that we typically expect. Now, finally, we're left with microhematuria. And so this is going to be our correct answer here. And the reason for that is because these recurrent episodes, along with his immigration from Sudan, as well as the pallor that's demonstrated on his fingers, kind of pieces together a diagnosis of sickle cell disease for us. And that's because he's coming from an epidemic country where there's high malaria rates, and sickle cell trait and sickle cell disease are protective of malaria. And so we see higher prevalence in that population. Furthermore, the pallor that's demonstrated is secondary to a vaso-occlusive crisis. So it seems like he's not getting adequate blood flow to his hands. And this picture of reoccurrence, where it's happened previously, kind of demonstrates that there's this recurring cyclical pattern happening, and it's likely due to the sickling of the red blood cells and these recurrent vaso-occlusive crises that this patient is incurring. And so hematuria or microhematuria fits a diagnosis because in sickle cell disease, not only can there be sickling in the hands and feet, but also there's sickling in the renal papilla. And subsequent infarction of some of the renal parenchyma will eventually lead to papillary necrosis. And predisposing factors for sickling include things such as hypoxia, acidosis, sudden temperature change, dehydration. So there's multiple risk factors, and in some of these conditions, that will lead to sickling and potentially cyclical pain episodes like this, where you have recurrent pain in his hands and feet, where he has vaso-occlusive crises, but also he can have papillary necrosis with recurrent sickling in his renal papilla. So let's get into a further explanation for this question. And so, as we were discussing, there's periods of decreased oxygen tension that will cause the hemoglobin to polymerize. So these abnormally shaped sickle cells will become polymerized and cause a complete vaso-occlusion um, under some predisposing factors. So common examples would be dehydration, infection, acidosis. Ultimately, all these things influence the oxygen tension, and then once that's decreased, it predisposes patients to having these vaso-occlusive crises. And as we saw, different areas will present with different symptoms. So the vaso-occlusion in the renal system can present with renal papillary necrosis, which will lead to the microhematuria and potentially macrohematuria. And here we can, it further demonstrates that sickling of the RBCs cause it to specifically stick to the endothelium. And then that kind of creates this barrier as more sickle cells join and completely occlude the blood supply to a certain area. So like we mentioned, there's numerous complications. Other things include things such as the functional asplenia that sickle cell patients eventually develop, as well as other hypercoagulable complications such as strokes. And finally, like we mentioned before, as this patient immigrated from Sudan, that's something to keep in mind, as that's a high risk area or an endemic area for malaria. And so individuals with sickle cell trait and disease are less likely to get more severe forms of malaria due to resistance that they experience. And so the reason for this is because the exact mechanism is unknown, but what's thought is that the sickle cells or the abnormally shaped red blood cells are actually protective from the malaria life cycle. And so our normal red blood cells are more likely to be affected, whereas sickle cells are less likely to get severe forms of malaria. Therefore, in countries that have high incidence of malaria, there's a higher prevalence of sickle cell disease and trait. So we should be more suspicious of that potential diagnosis, especially when we see a vignette with these kind of symptoms of recurrent pallor or recurrent vaso-occlusive crises. So this is an extremely high yield concept for the step 1 exam, and that was your question of the week. Thank you.